Hello, I'm Dr. Nick, the incrementalist, here today to talk about blunders and wonders. This week's blunder, misconnecting equipment. We're not big users of diesel fuel for cars in the US, but on the European continent, it's very popular. And for anyone visiting who's not familiar, they might make the mistake of taking the commonly found diesel nozzle and putting it into the gas tank of a gasoline or petrol-driven car. In fact, that's mostly not possible, since the nozzle is designed to be bigger so it won't fit into the gas tank opening. A simple but effective safety measure. The same principle has been applied to anesthesia, removing many of the opportunities for errors by standardizing on connectors for specific gases and cylinders that prevent connection of the wrong line to the machine. Sadly, this is not pervasive as a safety measure throughout healthcare, and you only have to watch one of the latest Hollywood medical dramas or set foot into a hospital to see the array of tubes and connectors that are ever present at the bedside. We use these connectors for a wide range of medical support to patients that includes nutrients and drains. Misconnecting any of these tubes to the wrong source can result in serious medical issues, delivering the wrong product to the wrong part of the body. Creating a standard for each of these connectors that prevents the connection of a nutrient line to a venous or arterial line on a patient is a simple safety feature that would go a long way to reducing errors. The FDA has urged making the connectors uniform to prevent misconnects, but these are voluntary guidelines and misconnects continue. In the interim, for your incremental step, don't modify or adapt intravenous or feeding devices, use color coding if at all possible, and trace lines from the end to the end every time there's a change or part of a handoff. This week's wonder, treatments that keep on giving. We've got a range of treatments that require continuous medication to maintain an appropriate dose to treat diseases. No matter what we give to a patient, the extraordinary body systems are designed to get rid of substances from our bodies, and that's true for drugs we use to treat disease. You'll be familiar with that if you take any medication, as the majority come in the form of a pill that you take once every day, sometimes multiple times per day. For tablets, this is relatively easy to maintain the appropriate dose, but for drugs that come as an injectable, that creates some challenges, specifically for access when individuals don't have access to care. Such is the case for treatments of age-related macular degeneration that causes blindness. Unfortunately, despite finding a highly effective drug that can prevent the disease, we still see a lot of people going blind because it's been administered by injection every 6 to 8 weeks. And that's a challenge, especially for the elderly patients who lack good access to transportation. Research presented at the annual meeting of the American Academy of Ophthalmology offered a new hope, showing off this implantable drug delivery system that meant patients could go up to 15 months between injections. But the news, in my mind, is even better, since this same methodology could be applied to other drugs and potentially in other countries where access to healthcare can be even harder and less frequent, like Africa. Now it might be possible to develop low-cost delivery mechanisms for other life-saving drugs as well as this one. Until next time, I'm Dr. Nick, the incrementalist. Don't let perfection stand in the way of progress.